Let's delve into the field of health. The medical professionals who volunteered to contain the deadly Ebola virus in Sierra Leone and Liberia will be rewarded for their service, according to President Uhuru Kenyatta. The president has instructed the Ministry of Health to give a job to any volunteer who is not permanently employed as a show of appreciation. The president was speaking at State House, Nairobi this morning after most of those who traveled to West Africa in January returned to the country.
155 out of the 170 medical staff returned Sunday and were driven to State House, where they were hosted for breakfast by the president.
We have been following what you have been doing, and to say that on my own behalf, on behalf of 40 million Kenyans, I want to say thank you for making our country proud.
The professionals included epidemiologists, public health officers, humanitarian officers, and health communication experts who were on a 6-month mission in West Africa to help in the fight against Ebola. Through proper diagnosis and isolation of patients, the volunteers helped to stop the transmission of the virus, which spreads through contact.
I thought it was a perfect opportunity because I felt like it was time for Africa to be for Africans, instead of going with other multinational organizations.
It was, of course, taking a risk that you would not come back. It was, of course, taking a risk that this disease would spread to come to East Africa. But that was a sacrifice.
Because of these people going to West Africa, it has been part of the reason why Ebola has been conquered in Liberia.
And for their selfless mission, the president says they will now be rewarded.
Hii watu mchunge sasa, lazima hawa hii equipment ambaye tumelete nini, kwanza patieni hawa kazi, hawa ndio wanatakikana. Kuwa the example, yeah? That it pays to sacrifice, that it pays to be committed. Look after these people and we will want to know how they are and how they are treated and how they are looked after.
The Kenyan volunteers also provided other regular medical services in major Liberian hospitals that were under immense pressure. Liberia has now been declared Ebola-free. In Sierra Leone, less than 15 cases are being reported in only 2 districts per week, from a high of 500 cases per week in December last year.
And we can deal with our problems, because it is not to say that we don't have challenges. We all have challenges. And we will continue to have challenges. But it is our determination to wake up and to rise to the occasion and to take those challenges that makes the difference between success and failure.
The returnees are considered as low risk, as they are said to not have interacted with any confirmed or suspected cases in the last 21 days. 15 medical professionals who are part of the Kenyan team have been left in Sierra Leone to wrap up the AU operation. Sharon Momanyi, KTN.